We now come to the urgent question. Liz Kendall.
Secretary of State, if you will make a statement on testing of care home residents during the COVID pandemic.
Minister.
Thank you, Mr. Speaker. The COVID-19 pandemic was an unprecedented global health emergency involving a novel coronavirus that we were still learning about day by day, even hour by hour. Even in those early days, the UK government and colleagues in my department were clear: testing would be crucial. That is why, Mr. Speaker, the former Secretary of State, the Right Honourable Member for West Suffolk, set ambitious testing targets to drive a true step change in the quantity of tests, because he knew testing would be a vital lifeline until the vaccines could be developed and proven safe and effective. The importance of testing was never in doubt, and there was full agreement on that in every part of government, from the Chief Medical Officer to the Health Secretary to the Prime Minister. But in a situation where we had the capacity to test at most a few thousand each day, tough decisions about prioritisation had to be made, decisions that were taken on the best public health advice available. And thanks in no small part to the bold testing ambitions driven by government, we were able to build the largest testing network in Europe. I want to put on record my thanks to all those who worked tirelessly on this mission day and night, from civil servants to the NHS, and of course our incredible social care workforce who did so much to look after their residents. They all deserve our lasting gratitude. Mr. Speaker, the situation in our care homes was extremely difficult in the pandemic, not just in England, but across the UK and indeed across the world, because of the vulnerability of residents and the large numbers of people who come in and out of care homes. It is vital that we learn lessons. It's equally vital, Mr. Speaker, that we learn those lessons in the right context. I should mention that selective snippets of WhatsApp conversations give a limited and at times misleading insight into the machinery of government at the time. That is why the COVID inquiry is so important, so we have the right preparations in place to meet future threats and challenges. Thank you.
Shadow Minister Liz Kendall.
Mr. Speaker, throughout the COVID pandemic, ministers repeatedly claimed they threw a protective ring around England's care homes and always followed the evidence and scientific advice. But WhatsApp messages from the former Health Secretary, revealed in today's Telegraph, suggest nothing could be further from the truth. Can the Minister now confirm that the Chief Medical Officer first advised the government to test all residents going into care homes in early April 2020? Can she explain why the former Health Secretary rejected this advice and failed to introduce community testing until the 14th of August, a staggering 4 months later? Can she publish the evidence that following the advice would have muddied the waters, as the member for West Suffolk claimed? And can she confirm that 17,678 people died of COVID in care homes between the CMO's advice and the government finally deciding to act? She should know, Mr. Speaker, because she was responsible for care homes at the time. Now, former ministers are touring the studios this morning, claiming this delay was simply because there weren't enough tests. Where is the evidence for this? And even if tests were in short supply, why weren't care home residents prioritised when the devastating impact of COVID was there for all to see? Now, Mr. Speaker, nobody denies that dealing with COVID was unbelievably difficult, especially in the early days. But care home residents and staff were simply not a priority. Yet the former Prime Minister and Health Secretary were first warned about the emerging horror in care homes by my honourable friend, the member for Hove, in March 2020. I myself raised the lack of testing in care homes with the Health Secretary. On the 8th of April, the 28th of April, the 19th of May and the 17th of June, long before the CMO's advice was finally followed. The Minister will no doubt say all these issues will be looked at in the public inquiry, but the findings from this won't be available for years. Mr. Speaker, the families of the 43,000 care home residents who lost their lives will be appalled at the former Health Secretary attempting to rewrite history, an attempt that will turn to ashes along with his TV career. We need more humility and less celebrity from the member for West Suffolk, and above all, we need answers.
Thank you, Mr. Speaker. Can I say actually that I think it's relatively easy for the honourable member to come to the House today and make these highly political points. And knowing actually how she and I worked together in the pandemic, and she and I talked about all that we were doing to look after people in care homes, I am, as I say, shocked and disappointed in the tone that she has taken today when we are dealing with extremely serious questions. I will turn first to some of the difficult prioritisation decisions that were made given the limited quantity of testing that we had at the beginning of the pandemic. Mr. Speaker, the government followed the expert public health advice available at the time. We had the capacity to test just 3,000 cases a day in mid-March, and I'm sure colleagues will understand why the health advice was at the time to prioritise those working on our NHS front line, and for instance the testing of people in hospitals who had symptoms, and indeed within care homes, again people with symptoms. In fact, the courts have already agreed that our prioritisation decisions on testing were completely rational. As we dramatically ramped up testing capacity, Mr. Speaker, we also adjusted that prioritisation in line with the public health advice and the capacity. So by mid-April, just a month later, with testing capacity exceeding 38,000, we were then in a position to test more widely. In fact, that's reflected in our adult social care plan, which was published on the 15th of April. That made clear that everyone being discharged from a hospital to a care home should be tested, even if asymptomatic, and that all discharged patients, regardless of the results of their test, should be isolated for 14 days. And it's worth reflecting, Mr. Speaker, just what a dramatic increase in testing the government oversaw, from just 3,000 in March 2020 to over 38,000 in mid-April to over 100,000 by mid-May, to the point where we could test many millions in a single week. We established the largest testing network in Europe from a standing start, and the science proves that it saved lives. Now, the Honourable Lady asked about some of the content of the WhatsApp messages which have been published. And I would say to her, that is a selection of messages from a larger quantity of messages. And actually, clearly, while there were discussions and debates between ministers and between colleagues which took place in part on WhatsApp, there were clearly meetings and conversations and other forums in which advice was given and decisions made. And a huge quantity of that is with the public inquiry. But I can say to her, for instance, that a meeting to discuss the implementation of the advice on testing was not referenced in the WhatsApp messages that she is talking about. But for instance, there is an email following exactly this exchange that she's referring to that says we can press ahead straight away with hospitals testing patients who are going to care homes. And we should aspire to, as soon as capacity allows, and when we've worked out an operational way of delivering this, that everyone going into a care home from the community could be tested. So, as I say to her, there's very selective information that she is basing her comments on. As I said, the Honourable Lady knows how the government and me personally strained every single work day and night, did everything in our power to help people, and specifically the most vulnerable during the pandemic. She and I spoke about it regularly during our frequent calls. In fact, at the time, I appreciated her perspective, her questions, her insights from her own area of Leicester. And I say to her, we should go about this discussion in the right way for the country. This is not the time to play political games. We should look to save lives. That's the purpose of the public inquiry, to learn lessons in the right way in case this should ever happen again.
Sir Oliver
My honourable friend will agree that it was Labour that called for a public inquiry. The government agreed to it. It's a full public inquiry. You couldn't have a better judge than Dame Heather Hallett, somebody one of our most experienced and distinguished judges. She'll do a very thorough job, and what we're seeing today is a bit of trial by media and party politics to sheer creep.
My honourable friend is exactly right. We're having a public inquiry. The government is fully cooperating with that public inquiry, so they have all the information that is required to look through all that happened, to investigate it, and rather than trying to score political points, to actually truly learn lessons for the benefit of the country.
Barbara Keeley.
Thank you, Mr. Speaker. On the 2nd of April, excuse me, on the 2nd of April 2020, I wrote to the former Health and Social Care Secretary, jointly with my right honourable friend, the member for Leicester South, highlighting the urgent need for testing in care homes for staff and residents, and particularly for patients being discharged from hospital. I knew, as did other colleagues at the time, that without testing, in my constituency, care homes in my constituency and those across the country were suffering a heavy toll of deaths of residents. Indeed, one of our care home managers died of COVID in my constituency. Further, at a session of the Health and Social Care Committee in July 2021, I asked the Right Honourable Member for West Suffolk why the government had not taken up the offer from care providers of facilities to isolate people discharged from hospital before admitting them to care homes. He told me that he did not know anything about the letter, despite it being sent by Care England. Will the Minister now admit that the Department and Ministers failed to understand and to involve social care in the key decisions about the COVID pandemic and ignored letters for offering help which could have saved lives?
Minister.
Well, the Honourable Lady is right about the importance of testing, and it's a view that she has, but I had at the time, and as indeed some of the exchanges will show, how I, as Social Care Minister, and as you would expect, was arguing very hard for testing for care homes. I know, of course, that other ministers and other people were arguing for the things that they had oversight of, and then ultimately, of course, the Health Secretary and Prime Minister have to make decisions based every step of the way, clearly, on the public health, the scientific advice on these things, as we did. I mean, to that point, during the course of the pandemic, as the capacity allowed, millions of tests were distributed to care homes. And as I've already said, as the capacity increased, care homes were prioritised in that process. And specifically to one of the points she made, the guidance set out on the 15th of April was not only that everyone discharged from hospital to a care home should be tested, but also that they should be isolated.
Exactly. Peter Byrne.
Thank you, Mr. Speaker. It seems to me that the opposition want to rewrite history. The fact is, at the time, people didn't know what was right or what was wrong. The Minister, the Secretary of State, listened to a whole lot of advice and then had to make a decision. Even one of the WhatsApp messages I've seen says, "Tell me if I'm wrong." So it seems to me what should happen is the COVID inquiry should deal with all these matters properly. The one question I would have for the Minister is it possible to get the COVID inquiry to report earlier?
Minister.
Well, again, I completely agree with my honourable friend about the COVID inquiry being the right place to go through the details of what happened, who said what, and, as he said, the genuine debates that there were, of course, behind the scenes, because this was a new virus. And at the time, we had only limited information about it. For instance, it wasn't known when it first hit our shores who was going to be most vulnerable to it. We didn't know about things like asymptomatic transmission. So there was a huge amount of uncertainty at the time about which the best possible decisions were made. To his question about the timing of the public inquiry, I think that is not something which is in the control of ministers.
Daisy Cooper.
Mr Deputy Speaker. Mrs Speaker, sorry, my apologies. The leaked WhatsApp messages from the then Health Secretary, the Right Honourable Member for West Suffolk, showed that despite a shortage in COVID tests in September 2020, one of the Minister's advisers sent a test to the Right Honourable Member for North East Somerset's home by courier. Wow. This is yet more evidence that it's one rule for Conservative ministers and another for everyone else. So can the Minister please inform the House how many other government ministers, Conservative MPs and their families received priority tests during the pandemic when there was a shortage of tests?
Well, actually, I would say to her, much though it's a difficult thing for me as a minister to see WhatsApp messages from me, in fact, in the pages of the newspaper. If she has read those, she will see that I was seeking a test for a member of my family and using exactly the same test app as everybody else to try and get access to a test that was needed.
Mr. Speaker, I seem to recall 2 years ago when there was a limited supply of testing equipment. There were all sorts of calls for certain groups to be prioritised, and there were urgent calls for available beds in hospitals to be freed up to cope with the likely surge in cases. In hindsight, some of those priorities may have been wrong ones, but at the time it was an urgent situation. Will my honourable friend confirm that exactly the same set of priorities about access to testing prevailed in Wales, and it took the Welsh Government 2 weeks longer to make mandated testing to care home residents in Wales than it did in England? And why are we not seeing equal outrage from the opposition about that?
Actually, he makes a really important point about the challenges that were faced, as I mentioned earlier, around the world handling the pandemic, but very conspicuously for us across the UK, and decisions that were having to be taken in Scotland, Wales and Northern Ireland, as well as here in England. And the other thing I'd say to that is, were members opposite in the position that we were in government and having to make these difficult decisions, I'm sure that they, like us, actually, would have strained every sinew and done their very best to make the best possible decisions in the situation of limited information.
Janet David.
Thank you, Mr. Speaker. Even if we now know that the Secretary of State was not following the scientific advice, the Minister for Care was in her job at the time these decisions were being made. Can the Minister explain why she didn't do the right thing then? Was she not listening to the Chief Medical Officer either?
I fear she didn't hear my previous answer, which was to say that actually the public health advice and the advice of the Chief Medical Officer was followed. Of course, there is a job to do. You get the advice, and then you also have to look at the practicalities of implementation. As the volume of tests became available, those tests were used as advised, following the public health advice.
Dr. Kiraman.
I'm not going to forget the totally shameless politicking of the pandemic undertaken by those opposite. I remember very specifically throughout the pandemic, she's left her place now, the Deputy Leader, talking about, and the Shadow Leader of the Opposition, talking about how we had the worst death toll in Europe, and they said that again and again and again and again. Actually, and I hear the Shadow Minister from a steady position saying we did. The studies now show that we were ahead of Italy, ahead of Spain, broadly in line with France and Germany, and very far from the worst in Europe. Have we ever heard any of them come to this dispatch box and apologise for misleading the British public about our record in the pandemic? Does she agree that they might seek to do that before they further criticise us for our record?
Again, he is right on this, and the right thing to do for us as a country is reflect overall on how we handled the pandemic and the decisions that we made, and indeed how prepared we were in the first place. That's the right way to do it. Of course, every life lost is a life that we regret losing, and I think about the families who've lost, whether it's mothers and fathers, brothers, sisters, grandmas, husbands. No, it's so deeply sad that so many lives were lost, but this is something that affected us here in England, say across the UK and indeed across the world. But the right thing to do is for us to look at these things in the inquiry and the reasoned environment, and then use the lessons learned and the reflections of that inquiry to make sure that we can do better in the event that we should ever have to face another pandemic like it.
Yeah. Karen Smith.
Thank you, Mr Deputy Speaker. The government entered the pandemic unprepared, ignoring Operation Cygnus and the lessons they could have done, and run the NHS at 96% capacity. That was part of the problem. We all know mistakes happen. We all know it was really difficult. But today is really disappointing because some humility should have been brought to this. Over 17,000 people lost their lives. It is our job as the opposition to scrutinise decisions. The former Secretary of State has thrown his colleagues under a bus because of his own vanity, but suggests that government ministers need to use this time to actually come forward, now that ease the family's suffering, with more detail on actually what did happen before the inquiry.
There's already been legal investigation into some of the aspects that we are talking about today. But actually, given the huge number of decisions that were made, the period of time we're talking about, actually the right way to do this is bring all this evidence together in the form of a public inquiry, have it fully looked through, and that's the best way to answer the sorts of questions that she's looking for answers for.
David Green.
Thank you, Mr Speaker. This is a profoundly serious question, literally a matter of life and death. And as such, I'm sure my honourable friend is right to say that the appropriate way to reach conclusions is through a proper public inquiry conducted by a very distinguished judge. So can she assure the House that the government will be as transparent and open as possible in giving evidence to that public inquiry, so that we can all be confident that at the end of this we have reached the appropriate conclusion?
I can absolutely assure my right honourable friend on that point that the government is sharing with the public inquiry a huge quantity of evidence so that it can reach the best possible, best informed conclusions.
Clive Efford.
Speaker, the emails and WhatsApp messages expose the fact that the scientific advice was that people leaving hospital should be swabbed before they went into care homes, and that the government ignored that. Now that shows that the government was not following scientific advice. Now the Minister has said that there were other priorities that had to be considered before they could implement that policy. But there's no one who'd be more aware of the competing priorities than someone like Professor Whitty. So what was it the government knew that Professor Whitty didn't when they decided not to follow his advice?
Again, it really feels like honourable members opposite have not been listening to my answers on this. The public health advice was followed, and the situation here was a limited capacity of testing. And this is not spelled out in those messages because, as I said, there were other meetings and other conversations that took place. As soon as capacity was available, of tests was available, further testing was used for testing residents, people being discharged to care homes, for example. And I will say to him, having been Care Minister at the time, how hard we, across government, not only me, but actually all of those involved in this, worked to get millions of tests during the course of the pandemic to care homes to help protect those residents, followed by prioritising those in care homes for the vaccination. Because actually, when it came down to it, though testing was helpful, what really made a difference in the pandemic was when we were able to vaccinate people, and that's what really started to provide protection.
James Wilde.
Isn't it regrettable, if all too typical, that the Labour Party ignored that when the pandemic struck there was only capacity for 2,000 tests a day and the huge efforts that were successful to massively increase that capacity? Instead, they choose to leap on partial information to make political points rather than listen for the full facts in the public inquiry.
My honourable friend is absolutely right how we ramped up incredibly fast, from a capacity of just 3,000 tests a day in March 2020 to over 38,000 in mid-April to over 100,000 by May, and then being able to test many millions a week during the course of the pandemic. That was the most extraordinary increase in the capacity to produce and carry out and analyse tests, and he's absolutely right to draw attention to it.
Derek Twigg.
Thank you, Madam Deputy Speaker. I note that the Minister said it's shocking what my honourable friend, the member for Leicester West, has said. It should be shocking about the number of people who died, who might have been saved in the first place. But can I ask the Minister a specific question? Is she really saying that there was no rush to get people out of hospitals back into the community without being tested at the beginning of this pandemic?
Well, I think the questions about the discharge policy that has been interrogated on a number of occasions, including, for instance, by select committees. And he'll well know, for instance, in general, and we know this in the work we're doing right now on discharge, that it's rarely a good thing for somebody who's medically fit for discharge to continue to be in hospital beyond that time. So of course it's right that when people are medically fit, they should be discharged home, and the guidance of how that was done was set out on a number of occasions during the pandemic, and that guidance was updated both as we learnt more about the virus and as greater testing capacity became available.
Alexander Stafford.
Thank you very much indeed, Madam Deputy Speaker. I am very proud of this Conservative government's record during the pandemic. 400 million tests, a world-leading and world-beating vaccine programme, and £400 billion spent to keep jobs and people's prospects going. Clearly, hard decisions were made, and hindsight is a wonderful thing, but we shouldn't be reflecting on hindsight now. We should deal with the facts that are at hand. Does the Minister agree with me that this government will continue to take measures, and if, God forbid, there's another pandemic, we will not let the party politicking get in the way and actually make those decisions to protect lives, fund jobs, and keep our country going?
He's absolutely right, and he's right to point out the extraordinary things that were done during the pandemic, and I don't think government should seek to take credit for that. So many people worked so incredibly hard, whether it was in local authorities, in social care, in the NHS, all those involved in supply chains, for instance. So the huge efforts to actually get PPE out and to secure PPE at times when it was incredibly hard to get hold of across the world. So I'm glad that he draws attention to some of these things, and he's absolutely right that we should reflect overall in the context of the public inquiry.
Emily Orbuck.
Thank you very much, Madam Deputy Speaker. In April 2020, now disappeared government guidance in relation to hospital discharges stated negative tests are not required prior to transfers, admissions into the care home. It was later reported that this minister then leaned on Public Health England to alter its proposed advice to care homes from ensuring that those discharged from hospital tested negative to not requiring any testing at all. Why, at every stage, was the government content to send people to their deaths in our care homes?
I don't recognise her account at all there. If she looks back in some of the one of the legal cases that has looked into this question, she may find more accurate information about some of the conversations that went on behind the scenes. What I can assure her of was that in my capacity as Social Care Minister, as you would expect, I fought the corner for people in receiving care, both home care and in care homes throughout the pandemic.
Aaron Bell.
Thank you, Madam Deputy Speaker. The leaked WhatsApp messages are obviously going to be partial and selective, but even reading them, I note that the Minister was doing her job on behalf of my constituents on a message on the 8th of April, speaking up for a care home in Newcastle-under-Lyme and raising that with government and her fellow ministers, and everyone, I think, was doing their best. I've served on the Lessons Learned Select Committee, Madam Deputy Speaker, and there are lessons to be learned. They can be learned with the benefit of hindsight, but the hindsight we've seen from the opposition front bench today is opportunistic. Absolutely. The government, does she agree with me, the government was doing everything it could to respond to an unprecedented situation under severe pressure, severe supply and severe capacity constraints?
He's 100% right. That the context clearly of this is absolutely important as part of this conversation, and a global pandemic about which very little was known, about which we worked incredibly hard to find out more, and continually made the best possible decisions in the light of the information we had, at all times prioritising protecting people, saving lives, particularly those, as we learnt, who would be most vulnerable. And it's extremely disappointing to see an attempt to play politics with this issue.
James Harden.
Thank you, Madam Deputy Speaker. Care home residents and their families weren't just failed at the beginning of the pandemic, they were failed for the months and years that followed as families and loved ones were prevented from visiting. Now, the leaked WhatsApp showed that the Minister was arguing against the ban on visiting. Can she say why we saw that sustained for so long throughout the pandemic, and what plans she has now to make sure that families of loved ones in care homes have the right to visit if this ever happens again?
Well done.
I know how strongly the honourable member feels about this, and clearly we're having ongoing conversations about visiting at the moment in care homes. It's evident in the WhatsApps that I was concerned during the pandemic to make sure that families were able to see loved ones in care homes. As I've been saying in a number of responses to questions today, clearly public health advice had to be taken into account all the way through the pandemic, and getting the right balance between protecting people from the risk of COVID being taken into care homes and seeing friends of family was something which I'm sure, as part of the public inquiry, will be some of the discussions that will be looked into in that to answer questions such as his about the decisions taken on visiting. And I will continue to work with him here and now to make sure that those who are currently in care homes get the visiting that we think they need.
Emma Hardy.
Thank you, Madam Deputy Speaker. Today's front page of the Telegraph revealing that the medical advice was not followed will be heartbreaking for so many families up and down the country, reopening the grief that so many felt over the loss of their loved ones. Now, I've listened carefully to the Minister's responses, and she said basically that she's unable to compel the public inquiry to move more quickly. It is above her pay grade. But what she could do right now is commit to lobbying the government to complete that public inquiry before the end of the year. She could commit to doing everything she possibly can to bringing those answers forward for all those families who are today feeling so deeply hurt and upset.
Minister. Well, so, firstly, on the first point of her question, and she's wrong about the use of public health advice, and all decisions were informed by public health advice. But on her request for the public inquiry is independent of government. It's independent of government. So what she's asking me to do is not something I can do.
Florence Shalomi.
Thank you, Madam Deputy Speaker. Just to reiterate the points that my colleague just made there. Every time there's a statement, every time there's a revelation, every time there's an issue about this raised, whether in this House or in the press, it triggers trauma for so many people who haven't healed over losing their loved ones, so many people who were not able to go to funerals, so many people who were not able to seek closure. I hope that the Minister will reflect on that in terms of her statement this afternoon. Just to come back on the public inquiry, does she agree with me and the COVID bereaved Families for Justice, who said that these revelations show why the bereaved families must be heard in the hearings for our lawyers to cross-examine people, including the former Secretary of State for Health, so we can get full answers to our questions in the right setting, instead of having to relive the horrors of our loss through these exposés?
Well, as I've said, what we are talking about is, very sadly, people's lives lost. And that is people's mothers and fathers, grands and grandpas, sons and daughters, sisters, brothers. We should always remember, when we talk about this, the genuine, real human cost. And also all those who, for instance, work in health and social care, looked after people who were dying and had such a traumatic time themselves. So she talks about trauma. I will say that it's her front bench who asked this urgent question and has made this conversation happen in this forum, rather, for instance, than happening in the context of a public inquiry, which might encourage a more reasoned form of debate. I'd say, but my tone, I hope she'll notice, fully appreciates the points that she makes, but it's not for me to dictate who will be giving evidence to the public inquiry.
Justin Mathers.
Thank you, Madam Deputy Speaker. As the Minister will recall, I spoke for the opposition on dozens of regulations to do with the pandemic, and there were occasions during that when I questioned some of the decisions that were being made, and the suspicion was that sometimes political rather than medical and scientific decisions were being taken. Clearly what has come out overnight has caused me to question that again. I hope she can understand why that is an important question of trust for us as politicians, but also for the wider public. And does she agree with me that rather than a partial and selective release of information to sell newspapers or books, that actually the public deserve the government to release all information now, so that we can actually get to the bottom of this?
Well, I do indeed remember many of those SI debates. I can assure him that it wasn't political decision-making, as he suggests. That every step of the way, ministers such as myself, the Health Secretary, and of course the Prime Minister, making incredibly difficult decisions, but always trying to do the right thing to save people's lives, to protect people from this cruel virus, which particularly attacked those who were most vulnerable, such as the frail elderly, and in doing so continuously took public health advice. And to his point, actually, that the way to look into all this that happened is indeed through the public inquiry. That's where the evidence is being provided, and that's a forum in which the reflections can be taken and the lessons can be learned.
Leila Moran.
Madam Deputy Speaker, my heart first and foremost goes out to those bereaved families. I just can't imagine what they must be feeling again today. And my heart also goes out to those care workers, many of whom also lost their lives. But also many of them survived having contracted COVID and now are living with long COVID. So they may not have lost their lives, but many did lose their livelihoods. The Minister may be aware that advice from the Industrial Injuries Advisory Council, which would give compensation to just some of those brave workers, is currently with the Department of Work and Pensions. In a recent meeting with me, the Minister told me that it could take years for this to be taken up. Can the Minister tell me what conversations has she had with DWP? And if it is going to take years, will her department set up a compensation scheme so they get the support that those brave workers deserve?
Thank you, Madam Deputy Speaker. As she says, care workers were amongst those who were at the front line at the pandemic and had some really incredibly difficult experiences and worked through even taking the risk themselves of catching COVID, and very sadly some care workers along with NHS workers were amongst those who lost their lives. As she says, others indeed have a long COVID. She asked me about compensation, which is indeed something that is currently with the Department for Work and Pensions. In fact, a minister from that department is here on the bench. I know his department is looking at this and will be responding in due course.
Jim Shannon.
Thank you, Madam Deputy Speaker. Can I thank the Minister for her answers? And truly, everyone's thoughts and prayers with those of all those who lost loved ones. The impact to mental health of the COVID lockdown has been felt most keenly in care homes. And to see what the elderly people were put through and learning that the full protections were not in place, and yet they couldn't see loved ones at the end of life, is totally unacceptable. What would the Minister offer to those who lost precious hours with those they loved and adored on hearing this very, very tragic news today? Thank you.
Well, I will reiterate to those living in care homes, but of course their loved ones and families as well, that the government took every step all the way through the pandemic to protect those who we knew were vulnerable. For instance, prioritising testing, over 180 million tests going to care homes during the course of the pandemic, prioritising vaccinations. And I remember at the time talking to residents in care homes and how the vaccination for them was such a huge moment, because actually it was the first time they really felt they were protected from this truly cruel virus. It's also, I know how incredibly hard it was for families that they couldn't be with loved ones in care homes. One reason why we put out guidance about visiting, particularly saying if somebody was close to end of life, that they should be able to receive visitors. And I will continue to do my utmost as Minister for Social Care to make sure that we do our very best for those living in care homes.
I thank the Minister for answering the urgent question. We now come to statement. Deputy Prime Minister.